Hi, I'm Omni. I received a double lung transplant about 2 years and 10 months ago. My lung problems began when I was 33 years old in the year of 2015. At that time, I was extremely active. I was a spin instructor. I worked full time as a physician assistant in general medicine. I rode my bike 60 miles every day until all of a sudden one day, I really couldn't walk up 3 flights of stairs to my apartment. I was very short of breath. I didn't know what was wrong with me. And it was hard to breathe from that day on. Wow. So everything started in the year 2015, but in 2018 is when the first time my doctor really told me, you're going to eventually need a lung transplant. And when I heard that, I was devastated. Like, I just felt like my world just collapsed inside of me. Like, I honestly felt like I had no more life in me. It was a very difficult thing to hear. At that time, I didn't need it right away, but I was definitely going to need one soon. I continued to try to work. I tried to stay even more active than I was before, although it was so difficult to breathe because I was on oxygen full time. Um, but it was very difficult. And, I went through a depressive state. I went through all the stages of grief actually when I heard that statement. So after my doctor told me about possibly needing a transplant in the near future, many things went through my mind. Like I said, I experienced all the stages of grief. It was within 2 years of her telling me this is when I was transplanted. So I really had like 2 years to emotionally, spiritually, mentally prepare. And I honestly did just that. I went from denial phase to angry, mad, to acceptance, to then being okay with having to have a transplant. And being a provider as well, a physician assistant in general medicine, I understood the statistics, behind being transplanted. I understood the side effects that could come along with it. I really understood it from not just a patient perspective, but also a medical perspective. So part of that was a gift and a curse because it gave me hope and then it also gave me fear. But once I was able to align my spirituality, my mental, my physical, align it all together, then I really got to a place of peace. And I was okay with it, and I was happy about it, excited about it, and I stayed away from my medical journals, and I just talked to people that had had a transplant and their experiences and how they were thriving afterwards, and it just gave me hope more and more each and every day leading up into that day I was transplanted. So after being transplanted I stayed in the hospital for about 3 weeks. My recovery, it wasn't so bad. And I believe because I did my best to work out as much as I could tolerate it before I was transplanted. I spent a lot of time doing yoga. I would swim. And although I had a nasal cannula in my nose, I still would walk. I would still do whatever I could. I did what I could control. And during my recovery, yeah, it was a little difficult as soon as you get out because they're trying to expand your lungs again. So you're breathing through this spirometer a lot, and that part was hard because you're like, I have new lungs. Why can I still not breathe and move this little notch up, But it takes time because your lungs are like a balloon, and you have to continue to expand them. So the recovery wasn't too difficult. It was just another part of the journey, actually. As far as pain was concerned, I actually didn't have any pain where the incisions were made. I was more so like muscle fatigued, is kind of what I experienced at least. But for the most part, it really wasn't that bad. I would have to say the most challenging part of my transplant journey It probably was when I was just transplanted, trying to breathe through the spirometer, getting up and walking because, like I said, my muscles were pretty weak and tired, and having to like walk around. That was probably the most difficult times. And then when I first got out the hospital, all the medication adjustments, because it's not a one size fits all. So going back and forth to the hospital every, I think, 2 weeks when I first got out, and they're changing the medications. That probably was the most difficult and most challenging part for me because that was kind of frustrating because I'm like spending all this money and they keep changing it. So I was always praying that we finally got to the dosing that was right for me. So that's probably what I would say would be like the most challenging. But that's just a given, especially when you're fresh out of surgery. So the hardest adjustments that I had to make after transplant, it's funny because before I was transplanted, like when I was first told I needed to be transplanted in 2018, all I could think about is, oh my God, I'm going to be wearing a mask everywhere I go. People are going to be looking at me crazy. But then, God heard me. And so I was transplanted in 2020 in the heart of COVID, and everybody's wearing masks, right? So, um, having to wear a mask, that was not very difficult for me, and that wasn't much of an adjustment like I thought it was going to be, because times changed at the snap of a finger, as we all saw. So I think for me, really the hardest adjustment was not being able to eat raw food anymore because I used to love sushi. I loved raw oysters. So just making sure that that's a part of my dietary restrictions whenever I go eat out somewhere, making sure there's no raw food. And I think also, too, not being able to eat pomegranates anymore because that was like my favorite fruit in the wintertime. So those would probably have to be the biggest adjustments for me, and just making sure that I'm not in smoky environments. But other than that, it hasn't been too much of an adjustment in my opinion. So it has been almost 3 years since I received my double lung transplant, and I actually feel amazing. I'm probably in the best shape of my life, honestly, better shape than I was before I was even transplanted. Emotionally, I feel amazing. I'm so much at peace. I'm happy. I just feel like this gift of life that was given back to me was the best thing that could have ever happened to me. And I always tell people when they find out about me having a transplant, honestly, I'm just so thankful that God chose me for this mission because it's changed my life. And I'm just so thankful, and I'm so blessed and so grateful for it all, actually. Since my surgery, the most noticeable difference in me, it probably just be my presence. Actually, I'm so much more peaceful. I'm so grateful. I'm joyful, and I think people can sense that when they're in my presence. I just feel like I exude such a peace about myself, and that's new. Honestly, this all came after I was transplanted, because of course I just developed a whole new leash on life and just a whole different perspective, and not taking things for granted, not anything for granted. Not even the breath that we are given for life. So I think that would probably be the most noticeable thing. Other than that, a lot of times people don't even know that I had a double lung transplant. They tell me all the time I don't look like what I've gone through. I'm so excited though, once again, to just be able to walk. I like to do 3 to 4 miles every other day, just be amongst nature, just breathing in fresh air. I'm excited just to be very active, getting on the bike. I participated in my first MS 150 and rode 100 miles, 2 days from Houston to College Station. I did that in April of this year, 2023. I'm just so excited just to travel again, just to live, because I just love life. And so, whatever that consists of living, I'm just excited about doing that, and even being with my family and just, being able to be there for them. even having this, being able to talk in this video, because there was one point in time I couldn't even talk without coughing a lot. So the ability just to be able to talk and not be in distress is something else I'm just truly excited about. What's really important to me in my life right now are just simple things, honestly. Nature, my family, my spirituality, my health, things that are pretty much priceless, me being able to breathe. Those are things that are just really, really important to me now. Wow, through this journey, I've learned a lot about myself. But one thing in particular I've learned is that I'm extremely resilient. I'm a very, very strong individual. And I don't mean just physically, but mentally, emotionally, spiritually. I always go back to those things because those like truly like my core values. But I have realized that there is absolutely nothing that I cannot accomplish once I put my mind to it. I believe truly that if you believe it, then you truly can manifest it. And yeah, those are some of the few things that I have learned about myself. In regards to learning about others, I do now understand that I see life in a different perspective. Um, and truly because of what I've gone through, obviously. And I can tell that when I'm amongst my friends or even family, I can truly tell that I'm in a different, almost in a different universe at times. The way that I think, the way that I feel, things that matter to me that don't matter to others, the things that I choose to participate in versus not. I can truly tell that I'm kind of vibrating in a different dimension than other people. And I'm okay with that. And I'm happy about it because it truly brings me joy and peace. But whatever you can do to prepare yourself for the surgery, if it's mentally seeing a therapist to get your mind together, which is something I did too, if it's getting your spirituality together, if it's getting your emotions together, your physical body together, then do that because it's all going to come together in the end. So just believe it and absolutely you'll conceive it.